Well, as we head into the winter months, we continue to monitor COVID cases. And there's some good news this week. COVID hospitalizations are down about 3%. That means just over 19,000 people nationwide are hospitalized with the virus. These are similar levels to March of this year. Now, I was talking nationwide, but in our area, hospitalizations have been holding steady over the past month in New York City. But in New Jersey, that number has actually ticked a little higher. That's why many hospitals in New Jersey are once again requiring everyone to mask up. 8 Hackensack Meridian Health facilities and all Robert Wood Johnson hospitals made the policy change earlier this month, citing a current rise in COVID cases. So to talk more about this, ABC News medical correspondent Dr. Darien Sutton. Doctor, good to have you here.
Great to be here.
What do you think about this idea?
You know, I think the way that I think about COVID is I think about the weather analogy. I think about COVID as precipitation. When it's pouring, that's when we have a surge, and when it's drizzling, that's when you want to just gather some levels of protection. And think about your raincoat or the things that you carry outside as your form of protection. And to make that an analogy, that's your mask. So right now we're having a drizzle. We have a couple of cases of COVID. We see that rate slowly increasing, and now you know it's raining outside. So you want to grab that umbrella, that rain jacket, and AKA that mask and that hand sanitizer.
It's almost common sense.
It's almost common sense, but it's going to unfortunately have to become a part of our natural behavior. I think when we look at the weather reports, we're also going to see what is the COVID rates, and I think it's going to help us make better decisions.
Yeah, better safe than sorry. You know, when it comes to COVID, there are new studies that show day 4 is the day you want to get tested. Why is that?
I think this is a fascinating study, and the study came from the question. Many patients were testing themselves on the first day of symptoms, and the test was negative, and they were confused.
That happened to me.
Like, why?
That happened to me. I'm like, I don't have it, I don't have it, I don't have it. Oh, I have it?
Exactly. There are a couple of reasons to that. So in this study, they looked at over 300 people who had recently had a COVID-19 infection, and they found that viral loads were the highest around day 4, and that was consistent with the most accurate test results, which were around day 4. So if you feel like you might have COVID, you take that first test and it's negative, I would protect yourself wearing a mask, protecting others, decreasing transmission. Repeat that test between days 3 and 5, and you might have a better, more accurate result.
Yeah, so make sure you have enough testing kits at home to do that.
Exactly, and don't throw them out, because the expiration date changes. So before you check that, check online.
Great tip. We want to switch to something else. It's Breast Cancer Awareness Week. When is the best time to get screened for that?
Screening and the conversation about screening should start at the age of 40. And so when we're talking about screening, we're talking about mammograms. And a lot of people have a lot of fear about this, and I completely understand it. But just know that if, in fact, breast cancer is caught at its earliest stages, the 5-year survival rate is more than 99%. And so my advice to patients when they're coming in with that new sensation or concern is to get that test out of the way.
You know, I also want to bring up the fact this isn't just about women.
Absolutely.
This is also about men. In fact, somebody at our office, they said that it runs in their family, and I said, have you been tested as a man? And he said he hasn't. I said, I'm going to stay on you. So please talk about just the importance for men getting tested.
I'm so happy that you brought that up. 1 in 100 new cases of breast cancer are in men. If you have a high-risk history, for example, a family history or genetic high-risk history, you want to start a conversation with your doctor. There's no official screening recommendation, but my recommendation for those who have high risk and any symptoms is to talk to their provider. You might need to get a mammogram, which men can get and many don't realize.
What a great tip. And get it done every year for a man?
It depends on your risk factors, but that also is an individualized plan that's created with you and your provider.
Right. Talk to your doctor as always. And we just talked to our doctor, Dr. Darien Sutton. Thanks so much for being here. We're really so wonderful.
Thank you.
Of course.
Do you have any other ailments you need him to check?
Well, my back. It hurts when I go like this, doctor.
Don't
do that. I know.